So now for the quality of the chest X-ray, so we are going to have now the quality of chest X-ray. Now, when you want to discuss about the quality of the chest X-ray, for the quality of the chest X-ray, you need to point out the fact that when you want to speak about the quality, you should know the mnemonics, the RIBES mnemonic. That's the mnemonics you have to use. RIBES mnemonic. Is it clear? Use the RIBES mnemonic. Now, for the RIBES mnemonics, those are the elements. The first element that you have on the RIBES mnemonics is a rotation. Is it clear? The rotation. Now, let's say that this is your X-ray, like this. This is the medial side of the clavicle. This is another medial side of the clavicle here. Now you're going to have the ribs below. You're going to have the sternum here. This is the manubrium of the sternum. This is the sternal body, and this is the forehead process of the sternum. So these are the different ribs that are going to come. You start from posterior. You have the different vertebrae, because you're going to have vertebrae, and you have spinous processes of the vertebrae that can be seen. You can see the shadow of the vertebrae behind. You can see the shadow of the vertebrae behind with their spine. Is it there? You can see the shadow of the vertebrae behind with their spine as such. So that's the diagram of your X-ray. So let's say that your X-ray is your disc. Now for the rotation, you need to know that the medial side of the clavicle has to be equidistant from the spine. So you draw a vertical line from the spine. You need to know that this large shadow behind that is a vertebral. The vertebrae is one vertebrae. Is it clear? You are going to have a large shadow which is going to show you one vertebrae. Are you understanding? And then you have a pinpoint white shadow like this behind, which is going to show you the spine. Is it clear? Now you draw a vertical line connecting the spine. Now you see the distance between this medial side of the clavicle and the distance between this medial side of the clavicle. You find if it is equidistant. If it is equidistant, it means that there is a good rotation. Is it clear? If it is not equidistant, it means that there was a rotation, a poor rotation that was done. Are you understanding? So the quality is not going to be good. So you say for the quality, you move now for the rotation. There is a good rotation. So they say, you see that the medial side of the clavicle is equidistant from the spine. Are you understanding? The second part after that is the inspiration. So inspiration, to know the good inspiration, you should count the number of ribs. Are you understanding? Now you should know that to count the posterior ribs, you count it from the vertebra which is behind coming in front. Are you seeing? This is one posterior rib. That's how you count 2 posterior rib, 3 posterior rib, 4 posterior rib. Is it clear? So that's how we count. You count from posterior coming anteriorly. Now the anterior ribs is where normally when you're coming in front, you need to know that the anterior ribs are the one that are going to stop. Is it clear? Because at the proximal, the medial aspect of the anterior rib, you're going to have the costal cartilage. You normally have the costal cartilage, but it cannot be seen with the X-ray. That's why you see it clear going in front if you take a true X-ray. Is it clear? So that's how we count the posterior and the anterior rib. So it's better to count the posterior rib from posterior. So we count 1 posterior, 2 posterior, 3 posterior, and 4 posterior. Is it clear? But now for a good inspiration, that's why every time they're doing X-ray, they ask a patient to inspire. Is it clear? For a good inspiration, we should see at least 8 to 9 posterior ribs, and we should see at least 6 to 7 anterior ribs. Is it clear? Now, if you see more than 8 to 9 posterior, it means that there is already a pathology called lateralization of the ribs, which is particular in a case where you have an obstructive disease of the lungs. Now, after inspiration, the next aspect of the quality that you have to speak about is the P on the mnemonics. P is for penetration. Is it clear? Penetration. Now, for penetration, you need to point out the fact that when you are speaking with penetration, you need to know that you should see in penetration, normally this is a hard shadow like this. The hard shadow is supposed to be like this. You are going to have a superior vena cava. You have the aortic arc, which is going to produce a different arches. The first arch is the aortic arc. The second arch is the pulmonary trunk, and then the last arc is the left ventricle. So those are the different things. Now, for the penetration, we need to see the vertebral column or the spine behind the heart shadow for you to see that it's a good penetration. So for a good penetration, you need to see the vertebral column or the spine behind the heart shadow for the good penetration. Another element for good penetration, you need to know that what the blood pulmonary vessels which are opaque, the pulmonary vessels which are opaque fibers, you have some opaque fibers that which shows pulmonary vessels has to be that should be at most 2 centimeters away from the thoracic wall. So when you see the pulmonary vessel 1 to 2 centimeters away from the thoracic wall, ensure that there is also a good penetration on the X-ray. So that's a good quality. Are you understanding? Now, the fourth element after the penetration, we have the E is for the exposure. Is it clear? Now, for the exposure, you need to evaluate the lungs field which are inside. Is it clear? If you see completely the lung field is a good exposure. A good exposure is one that you can see completely the lung field. Is it clear? In the lung field, you should visualize the superior lobe. Is it clear? You should visualize the superior and the inferior lobe in the left lung. And you should visualize the superior, in the right lung, you should visualize the superior, the middle, and the inferior lobes. And in the left lung, you should visualize the superior lobe, you should visualize the lingular region, and then you should visualize well the inferior lobe. Is it clear? So those are the different things that you should have in mind. Is it clear? Because those lobe visualization are also important because they can make you know the different segments which can be involved in a case of the patient that has any disorder in the lungs. And you need to know that each of the lungs have 10 segments. Is it clear? Once 5 segments is going to be located where? It's going to be located in the superior. Is the superior lobe. Is it clear? 5 segments located in the superior lobe. 2 segments is going to be located in the middle lobe, and 3 others is located in the inferior lobe. No, it's 3 segments which is located in the superior lobe. 2 is going to be located in the middle lobe, and then 5 is going to be located in the inferior lobe. Is it clear? So those are the different segments that you have to know, and then certain pathologies is affecting the different segment. In the superior lobe, you have the apical, you have the inferior, we have the apical, you have the anterior and the posterior. While in the middle, we just have the medial and the lateral, and then in the inferior, we have all what is in the superior and what is in the middle, except the apical, which is changed by the superior pseudo segment of the lung. Are you getting? So those are the different things you have to understand. And now in the left lung field, the middle lobe is replaced now by the lingular region, where we say the medial and the lateral lingular pulmonary segments. So those are the different elements. Now after the exposure, you need to speak about, and the exposure, you need to visualize all the lung field, and they are usually dark. Dark in X-ray is called lucency. Is it clear? When you are having X-ray, you call dark lucency, and when you are having white in X-ray, it's called opacity. Basically, an opaque structure is going to be having the same consistency, a same optical density like bone, slightly the same optical density like bone, while lucent structure is having a slight optical density like air or fluid surfaces like water. Is it clear? So those are the different things that you have to put in mind. Now it's going to have lucency is having more optical density like air, while white is having more optical density like bones. is it clear, or fluid, is it clear. So those are the different things that you have to put in mind. Now the next thing after that, after the exposure, we have the S now, which is for the scapula. So you need to also visualize the scapula posteriorly, is it clear, and the joints. So you need to know that you have the scapula somewhere like this, and then you should also visualize the glenohumeral joint. So this is the scapula posterior there like this. You should visualize the scapula, you should visualize the glenohumeral joint, is it clear. So you have this, so this is what should be visualized. At least you can see up to the glenohumeral joint. You have another scapula here, and you have another glenohumeral joint here, is it clear. That is S for the scapula. So those are the different elements which can tell you that it is a good x-ray, but usually this S, which is for the scapula, is not taken too much in consideration, is it clear. So those are the elements for you to tell you that those are to show you the good quality of an x-ray. After the quality of the x-ray, the next thing you're going to visualize now are the pathologic signs that you can visualize on x-ray.